Welcome, everyone that's joining us for today's session. I'm pleased to welcome again our resident ataxia expert, Dr. Susan Perlman. Dr. Perlman is a clinical professor of neurology and director of the Ataxia Center at the UCLA Medical Center in Los Angeles, California. Welcome, Dr. Perlman.
Thank you so much for having me back. And I have to say that you become an expert in something because you do it over and over and refine your knowledge and your knowledge base, which I've only been able to do over the years, by interacting with our patients and families. So, the conference, a couple of weeks ago was a wonderful opportunity to do that, to
Yep.
meet with, our patients and families, get into some good discussions, meet with some of my colleagues, who gave me some new ideas, and also meet with industry. There's an increasing interest in industry in developing drugs for these rare disorders. So I think it was, one of the more productive conferences that I've been to in a while. Now, here's the first question that made it to the Q&A. What's the best treatment for numbness in my arms? My arms from funny bone to the pinky and ring finger go to sleep easily, and I have nerve pain when they are numb. This seems to happen when I sleep on my side or fall asleep with arms bent. So, the average description, if you put this into an AI option, would say that you're probably pinching your ulnar nerve, which goes around the back of the elbow. In any of those positions, that seems to bring this on. And it can give you numbness and also, tingling or actual pain in this area. And the usual treatment is don't sleep like that. Don't bend your arm like that. If you tend to lean your arm on counters to stabilize for typing or other things, wear elbow pads. If this is a recurrent problem, it could be that your ulnar nerve is sitting on top of a bony prominence, which makes it liable to be pinched. And surgeons can do a minor surgery to relocate the ulnar nerve so it's not near that bony prominence. I have ataxia type 6. I hate ataxia. I seem to be worse than people that have the same thing. I hate feeling like I am falling all the time and usually do. I have been researching medications to take, and there's a list of them on the National Ataxia Foundation website, but my doctor says no to everything. She doesn't understand how I feel. Now, one of those concerns is that, it might not be that the doctor doesn't understand how you feel or doesn't understand the potential benefits of certain medications, but because of other medicines you're on, there could be interactions with some of the ataxia medicines that you've cited. So, I think it's important to have open discussions with your doctor. Now, the medicines that you cite are the ones most commonly used off-label: regular riluzole, dalfampridine, and Artane, for balance and also for speech. Troriluzole is not yet approved for use. It's in the hands of the FDA right now. It is being considered for approval, but in the interim, the Biohaven company has been making it available compassionately. And it's possible that your doctor is unaware of that program. But certainly regular riluzole and dalfampridine can be helpful for some people with balance issues like ataxia type 6 and others. And one thing I learned at the conference from Dr. Schmaman at the Mass General in Boston is that people with ataxia, and in that case it was ataxia type 6, may have changes in speech that are coming not just from the cerebellum, but from other nerve pathways. And Artane, an older drug, trihexyphenidyl, which has been around for a while, may help that. The only downside of Artane is it can dry your mouth out, which can then make your speech worse. But definitely have a good discussion with your doctor. Bring references that may help reorient your doctor's understanding. Are cuts to the FDA likely to affect review of troriluzole? Everybody is anxious about the budget changes affecting the NIH and potentially the FDA. It's expected it may slow things down, but it's not going to alter the approach to good research that supports an orphan drug for a rare disease. And the timeline for troriluzole is, they're going to be spending hopefully the next month or two inspecting the sites where the study was done, and then coming to an opinion, we hopefully late summer or early fall. Which specific genetic ataxias have found benefit from troriluzole? So the ones in the study were SCA1, 2, 3, 6, 7, 8, and 10. But any SCA that affects the cerebellum could benefit from troriluzole or even regular riluzole. So, in the compassionate program, Biohaven has made troriluzole available to any SCA diagnosis from 1 to 50, not just the ones that were involved in the study. Side effects may limit the benefits for some people, but it's worth investigating. So here's an individual. My 64-year-old mother was diagnosed with hereditary ataxia 2 years ago. It's progressing fast. My mother has balance, speech problems, and already needs a walker. And this was after only being diagnosed 2 years ago. There isn't orthostatic hypotension or bladder dysfunction. Her neurologist mentioned several times that it could be multiple system atrophy, which, as far as the ataxias go, can progress more rapidly than a regular ataxia. But multiple system atrophy is not a hereditary ataxia. So her mother's doctor recently prescribed levodopa benserrazine, which sounds like a combination drug similar to carbidopa-levodopa or Sinemet outside the United States to help with symptoms of multiple system atrophy, but it can also help with symptoms in other forms of ataxia, specifically ataxia type 2 and 3. Isn't it too early to change the diagnosis to MSA and take this medication? If there are indicators that MSA is the correct diagnosis and genetic mimics have been ruled out, and the ones that we're aware of now, Canvas is a genetic mimic of MSA, and SCA3 is also a genetic mimic of MSA, but they tend to progress much more slowly. So if her neurologist feels there's enough evidence to label it multiple system atrophy and to try this symptomatic medication, which is a reasonable one to try, I would definitely try it out. However, there are very new and I think potentially very effective drug trials starting up for multiple system atrophy by several companies. So that if your mother is living in an area where one or more of these drug trials is underway, she should apply to participate in one of those trials as well. Now, the next question, is Vico going to have SCA3 in their studies in September? Yes. Easy answer. What is your opinion regarding CoQ10 supplementation for neurodegenerative disease? In particular, late onset, and I presume that's late onset cerebellar ataxia. I can't see to the bottom of that question. Let me scroll down. Late onset ataxia. So CoQ10 is a cofactor for energy production in nerves. Nerves are highly energy dependent for good performance. So many people with degenerative diseases of all types, genetic and non-genetic, and in this case, late onset ataxia, can use CoQ10 to enhance energy production. The normal dosing is between 400 milligrams per day up to as much as 1,200, but higher than that is not going to get any more of that supplement into the brain. So I think it's reasonable to try it and see if it will improve any symptoms. Give yourself at least 3 months on it before deciding it works or it doesn't work. Can serotonin syndrome cause abnormal eye movements that do not show up as nystagmus when examined by a neuro-ophthalmologist. My eyes jump just before I fall. How can these be detected? So, serotonin syndrome can definitely have a variety of symptoms, not typically nystagmus, but it's an overstimulation from an important neurochemical that's involved in our coordination and balance pathways. Now, the fact that your eyes jump before you fall may just be a part of the ataxia that you have. Typically, when we're getting off balance and our body is moving, our head is moving, there are eye movements that compensate for that so we can keep our vision straight despite everything moving around us. If your ataxia includes changes in the pathways from the inner ear, there could be an eye reaction that's not nystagmus that will appear responding to movement associated with almost falling, and it's a sign of changes in those connections that are not functioning perfectly in ataxia. Now, there's testing that can be done in the office or even a neuro-ophthalmology office or an ENT office that will demonstrate that that particular connection that you're describing is a little off. And I think, you may want to talk to your neurologist about further examinations for that. Then here's a question about numbness in arms. And I think we already answered this one earlier, so it has reappeared. The next question, what's the best thing to do to maintain mobility with ataxia? Basically, stay on your feet and keep moving. I use 2 hiking sticks to walk up to a mile. So even though you're using 2 hiking sticks to maintain rhythm and balance, you're moving, and that's the most important thing. So even walking with a walker, as long as it gets you moving in a safe way, is going to really protect your mobility with ataxia, and it's good exercise. Can you bring us up to date with troriluzole? We just were mentioning that it's in the hands of the FDA. Its analysis may be slowed up a little bit because of the budget changes, but the next step is that the FDA will be sending out inspection teams to some of the sites that were conducting the study to make sure their record keeping is okay. Then, their committee at the FDA will look at all of the data that troriluzole, was generating and what it was compared to. And we should have an answer by the end of the summer, early fall, whether it will be approved or not. And as I mentioned, Biohaven is making it available compassionately for people with spinocerebellar ataxia of any type, type 1 through type 50. Is prognosis different for each type of ataxia? Yes, it is. Is progression vastly different for each person based on their circumstances? Yes, it is. So each of the ataxias, depending on the severity of the ataxia symptoms and associated symptoms they may have, can determine the prognosis, how quickly you're going to end up using assistive devices, when you might require a wheelchair. So that, types of ataxia that affect midline cerebellar functioning, upright stability, standing, and walking more than hands, for instance, or speech, are usually going to require assistive devices earlier than other types of ataxia that may, for the first few years, mainly have tremor. So that's an important thing to look at, your particular ataxia type. And progression, even within the same type, can be very different based on the rest of the person's genetic makeup. If you have longevity in your family, those anti-aging genes could slow progression. And also healthier lifestyle, better attention to exercise from very early in life can build up reserve that could slow progression. So these are definitely things to look for and to enhance in your treatment regimen. Judy is asking, are gaze exercises beneficial for canvas patients. Gaze exercises can be used to improve communication between the inner ear and the eye movements and the cerebellum, can also be used to improve coordination of the eye movements themselves, which can then help with balance and reduce feelings of dizziness or instability. So many physical therapists working with somebody with ataxia, and with Canvas, there is vestibular involvement, will start doing vestibular compensation exercises that involve eye movement and head movement to help stabilize the vestibular component of the ataxia. What is the importance of identifying the specific type of ataxia you have, and how can the type of ataxia be determined? Thank you for reposting that. I saw that in the chat, and I'm glad you've added it to the Q&A. The importance of identifying the specific type of ataxia, now the first major division, is this an ataxia from an acquired cause, a vitamin deficiency, a exposure to a poison or toxin, an immune system problem? Because those have very specific treatments that could then improve your symptoms of ataxia. Specific type on the genetic side, often insurers, payers, the people who will pay the medical bills for people who are insured, will question, is it useful to get genetic testing? Will knowing the specific type of genetic ataxia you have change your management? I've heard that over and over from insurance companies. But now, with all the research going on and access to research protocols that are specific for ataxia type 3, ataxia type 1, multiple system atrophy, knowing the type you have will enable you to predict things that might be coming up in the future, whether it's research opportunities that you'll be able to participate in, or just things to be careful of in the basis of your own living with ataxia. So you can absolutely, knowing your specific type, improve your quality of life and open up doors to what could be successful research. Also, if it is a genetic ataxia, then there's counseling that can be done with other at-risk family members. So how can the type of ataxia be determined? The first step, that many clinicians will take is ascertaining, is there a family history? If there is a family history, the next step would be to obtain genetic testing, either for the known ataxia in the family, or if it's never been tested before, there are testing panels that will help, hone in on the genetic type. On the other hand, if there's no family history, many clinicians will pursue an excellent and detailed workup for vitamin deficiencies, hormone problems, toxic exposures, immune system problems, small hidden cancers that can produce antibodies that may attack the cerebellum. So just because you have a genetic ataxia in the family doesn't, make you immune to these other factors. And I've worked with families where there was clearly a genetic ataxia, and then somebody turns up with symptoms, and it turns out that it's multiple sclerosis. It's not the genetic ataxia at all. So definitely keep your eyes open, keep doors open. Don't get into a box. Everything that happens is not going to be from your ataxia gene. And you can't write everything off and overlook something that is going to be potentially treatable. Rita has a question. What do you know about dalfampridine? Dalfampridine helps to regulate electrical channel activity in nerve pathways, whether it's the long nerves with myelin insulation or the smaller nerve pathways in the cerebellum. It can, it's been available by compounding pharmacists for years. I remember working with it when I was a trainee for patients with spinal cord injury, improving, the communication along those damaged spinal pathways. Now, more recent research resulted in it being approved for multiple sclerosis for gait, speed of walking, which again depends in part on spinal pathways. But our experience, certainly suggests that it can be helpful for ataxia. And, it's, shown benefits for dizziness, that can be associated with ataxia. So I think dalfampridine definitely deserves a place on the list of things that you could try to help with ataxia symptoms, to stabilize those nerve pathways. It tends to have a very good side effect profile. High doses, however, could lead to a risk of seizures. So if you do have a history of seizures, using dalfampridine, should be approached with caution. But it's definitely one of the medications that is accepted for use for episodic ataxia and off-label use for general ataxia balance and coordination problems. Alice is asking, can ataxia impact the function of your esophageal sphincters, upper and lower esophageal sphincters? We know that any ataxia associated with neuropathy can affect the GI tract. The muscles in the GI tract are controlled by nerves. So if your ataxia has a neuropathy, then your bowels can slow, your stomach can slow, swallowing can be slowed. On the other hand, the cerebellum controls coordination of basically every body activity, so that upper esophageal function is very impacted by cerebellar disease. And incoordination of swallowing can lead to coughing and choking when the upper protective sphincters are not coordinated. They're closing and opening, relative to breathing. So yes, it's good if you are seeing your doctor, about balance and coordination. They should be asking you about other muscular functions that require coordination. Deborah says, my husband has atrophy of the vermis. His condition is progressing rapidly. Will he eventually become stable? So that depends on the cause. What is the cause of the atrophy of the vermis? The vermis is the very middle of the cerebellum. It's the part that all the signals that the cerebellum is sending out go through the upper vermis, and incoming signals that help the cerebellum coordinate, areas of the body that are sending messages to the cerebellum. So the vermis is like Grand Central Station. And it can be affected by a variety of poisons, toxins, vitamin deficiencies, immune system problems. And in certain of the genetic ataxias, the problem will begin in the vermis. With Friedreich's ataxia, the vermis is affected fairly early. Now, the fact that there's rapid progression, I would want to make sure that there's not a hidden acquired factor, a toxin, a poison, an immune system problem that is putting stress on that area. Will he eventually become stable? If there is an identifiable cause that can be treated, certainly it could stabilize and even reverse some of the symptoms. If this is a response to a limited internal process of some undefined type, stroke, for instance, you can have rapid progression right after the stroke. There can be slow healing, but ultimately it will stabilize. So finding the cause of this is the most important thing you can do. Now, here's an anonymous attendee. I have SCA8 with severe mitochondrial problems that show up in blood work. My main symptom is muscle weakness. Legs turn off after walking a minute or two. This all started with menopause. Any connection between ataxia, mitochondria, and hormones? We know that hormonal changes can worsen a variety of brain-related activities, whether it's activity in the cerebellum, activity cognitively, sleep-related pathways, all can be upset by hormonal changes, whether it's menopausal hormones, thyroid hormones, so that if there are any indicators in respect to your balance issue that could be explained by a non-neurologic process, definitely make sure you have your hormone levels checked and be treated appropriately. Now, mitochondria, complex little organelles that generate energy within nerve cells and other important cells in the body, including muscle, so that the increased muscle weakness and fatigability that you are noting, if there is a mitochondrial problem showing up in your blood work, it could be selectively affecting the muscles, which are highly energy dependent. They can function for short terms without generating energy. But then for the long haul, for walking for a period of time or just staying active, they really need to generate energy. So that mitochondrial problem, if it has been defined, is it due to a genetic mitochondrial issue? Definitely can be addressed with mitochondrial supplements. So there are things that you could use to prop up the mitochondrial side of this while you continue to work with your SCA8 side. Therese is asking, can you give us any info on the drug taltirolin? Taltirolin is available in Japan under the brand name of Seradist. And I believe there's, ongoing research to develop an even better formulation of it. It has been available for over 20 years in Japan. And one of the first discussions we had in our cooperative ataxia research group, with all the ataxia docs that are involved in drug trials, this was 20 odd years ago, was should we be testing taltirolin in the United States? It never moved further than that. The Japanese company has not reached out to the FDA to, do further testing here. But it is purported by its action on thyrotropin releasing hormone pathways, again, hormone related, to improve and stabilize cerebellar function. To get it, although there was rumor you could get it online at one point, I'm not sure about that, most patients end up traveling to Japan, meeting with a Japanese doctor, and getting a refill that will last them until their next trip to Japan. So it's not an easy drug to get, but it's one to keep our eye on, certainly for people that could access it through those Japanese doctors. Then anonymous attendee, does dalfampridine help ataxia patients other than those with SCA27B? Yes, we mentioned episodic ataxia, which, has been treated with the Diamox, an older drug, and then dalfampridine more recently. Dalfampridine was found to be specifically helpful for problems of balance and coordination in SCA27B. Not clear why it's that specific, but we use it with other ataxias as well, as a symptomatic drug to try to help improve movement coordination and balance. Common side effects, usually there's very few side effects with the exception of things at higher doses where there's a potential risk for seizures. So that if you're thinking of trying this drug or would like to speak with your local neurologist, definitely get into a good discussion. I think it's reasonable to try for anybody with gait ataxia. Judy mentions, for my cough, I take 300 milligrams of gabapentin twice a day. What canvas side effects should I be concerned with? Now, gabapentin is kind of the vitamin C of nerve performance. Back in the day when Prozac first came out, everybody was starting Prozac to treat a variety of symptoms that, it really shouldn't have helped with. And gabapentin has become very useful for treating anything to do with nerves, peripheral neuropathy, nerve pain. And the cough in canvas is felt to be a neurogenic cough. So the primary side effects of gabapentin, drowsiness. People feel tired, they feel sluggish on it, depending on the dose. There aren't any other severe side effects. And, the best thing is if you wish to try it for a symptom of neuropathy or the canvas-related cough, try it, with care and make note of anything that changes that could be a side effect. But the most common side effect I've heard people complain about is drowsiness or sluggishness. Now, we have a question about MitoQ, which a number of years ago was in testing, or was to begin testing for Friedreich's ataxia. That did not move forward in the official testing pipeline, but it is still available. I know that it's available in Australia, New Zealand, and is touted as an anti-aging supplement. similar to CoQ10, which it's related to, or idebenone, which is part of that same family of drugs. Combining MitoQ, if you have access to it, with CoQ10 or idebenone, interesting question. MitoQ gets into the mitochondria to improve control of free radical stress, 1,000 times better than regular CoQ10. But it can't enhance energy production. It can soak up free radicals, but it cannot be used as a cofactor for energy production, while CoQ10 is itself a cofactor. Idebenone is as well. Taking CoQ10 and idebenone together, not really helpful. Combining MitoQ with an energy producing cofactor like CoQ10 or idebenone is reasonable, and you should not have additive side effects. Which act more on the whole body other than just mitochondria? Well, they act where mitochondria are important. So mitochondria are important for the heart. They're important for regular muscle. They're important for nerve-related activities. So that taking any of these agents, will, hopefully improve mitochondrial function wherever those mitochondria appear. So on an ataxia Facebook group, people were talking about using weighted vests for balance. Never heard of this. What is your opinion? Work with weighted vests to stabilize the core has been in the ataxia armamentarium for a number of years. There are, companies, at least one that is well known, and other companies that have developed vests that you can put weights in, can shift the weights around to improve your center of gravity. Weighted vests are also used for people who are training in bodybuilding. It gives them, again, more weight that they can move against, which will help build muscle. But its use for balance really depends on getting the weights in a way that will enhance the central core of balance and not throw you off. And some individuals who, husbands are engineers, they've designed and put together their own weighted vests. There are physical therapists who work with these, and I would, ask your local physical therapist if they have any familiarity working with a weighted vest for balance. Alice is asking, other than having restless legs or neuropathy, how can ataxia impact sleep? It can affect the sleep cycle so that some patients with ataxia will experience sleep apnea, such that during sleep, the automatic processes that keep the airway open so you continue to breathe while you're sleeping, when the rest of your muscles are relaxed, can lead either to snoring and interrupted breathing, or to stopping breathing for long periods of time. So that is one fairly common thing, that if you suspect you're having a sleep problem and you wake up in the morning feeling exhausted and you run out of steam partway through the day, think about having your sleep pattern assessed for its efficiency. Other things that can impact sleep, with multiple system ataxia specifically, you can develop vivid dreams, nightmares, acting out your dreams during sleep. These are called parasomnias and can definitely disturb sleep, and can be pretty easily treated. So again, talk to a sleep expert about, being assessed for any of these indications. Is there a downside to using an over-the-counter NAD supplement for Friedreich's ataxia? I know there's been a lot of interest in using NAD, not just in Friedreich's, but in other ataxias, ataxia telangiectasia, to enhance energy production, in mitochondrial mediated pathways. And then they mentioned CHOP is in a stage 2 study of assessing whether NAD improves mitochondrial function. I know they've had a study looking at NAD supplements plus exercise, to see if there's, any better way to measure the benefits of NAD. But over-the-counter NAD is quite similar to the NAD that's used in the research studies. And again, any supplement, clear it with your doctor. Nicotine adenine dinucleotide. It's a cofactor for energy production. And it can be used in combination with other cofactors like CoQ10 we were just discussing, but it has some special interest in Friedreich's ataxia and ataxia telangiectasia. So if you want to try it out, clear it with your doctor, use it for 2 to 3 months and see if you feel better. Okay, here's a question from Michaela. I'm 30 years old and have SCA3 ataxia, but at the moment I am asymptomatic. So you have a positive gene test, but no symptoms, even though you've had the gene since you were born. I want to get pregnant, but my partner and I need to know that there are scientific studies that support that the hormonal process that a pregnancy entails does not cause ataxia to develop earlier than it should be. I am not aware of any study that has demonstrated that the hormone changes associated with pregnancy can bring on ataxia sooner. I think, if you, want to, start a family, your dream of being a mother, but, you're obviously weighing, if getting pregnant is going to make you worse, or bring on symptoms earlier, then it's not a path you'd want to travel on. So, Lori, keep a note of this question. I want to look into the literature and just see what I can find out about hormone influences. We've already been talking about hormone influences. Thyroid hormones, menopausal hormone changes can worsen symptoms of ataxia, but would not necessarily cause ataxia. So, Lori, I will look this up further and get back to you about that.
Got
Now,
it.
I am not seeing the rest of our Q&A chain here. I think it got disconnected.
Oh, I can read you some of
Go
our
ahead.
other questions here. All right, so Clark is asking, do bladder and bowel problems happen with ataxia?
Yes, the muscles in the bowels and bladder have to be coordinated like any other muscle in the body. So it's not unusual to have bowel or bladder in coordination, which is usually can be treated. Okay, I see a few questions popping up again. I think I'm reconnected, which is good. My brother is diagnosed with RSACs. Are there any medicines available to help with the symptoms? So the same medications we've been talking about with, symptom management of ataxia would definitely apply to RSACs. Plus, RSACs has the additional symptom of spasticity. And there are many drugs that are available to treat spasticity to improve movement coordination and balance. Are you aware of any research study which is close to finding a treatment? I know there are research studies in progress, specifically for RSACs. And these can be found on clinicaltrials.gov. So that, further exploring that, will give us more information. Your brother is now 29. He can still walk without assistance. And you want to know if there's any way to slow down the progress of the disease. We know for a fact that exercise, cardio type exercise, increases nerve growth factors, which can protect nerve pathways. So that keeping up with a good cardio exercise program can slow progress of any of the ataxic disorders and also protect your muscles from becoming innocent bystanders. Sean is asking, can uncontrolled spasticity or flailing at night be a symptom of ataxia? Yes, it can. And can be anything be done for it? Yes. There are medications that you can take at night, depending on the type of involuntary movement or flailing that's going on, that will suppress it. It seems to be triggered by movement in the environment, and you'll shoot your arms out like you think you're falling. So it sounds in part like a parasomnia, and there are definitely ways to address that. So have a discussion with your doctor about these sleep-related phenomena and let them try a couple of things. Miwa is sharing that I had thyroid cancer earlier this year. Is there any relationship with SCA? So thyroid cancer or any cancer in the body can trigger the production of antibodies that could attack, cross-react and attack cerebellar pathways. So that's one thought, be screened for persistent antibodies that could be triggering or worsening symptoms of SCA. Now, thyroid disease, if it's treated, may result in a reduction in the levels of thyroid hormones that we need in order to keep our brain and nervous system functioning well. So again, make sure that your thyroid hormones are in good balance. I have seen people who have had, cancer in the thyroid or thyroid disease who also have parathyroid disease. Those are the small glands that sit behind the thyroid. So checking on the balance of the parathyroid hormones could also be appropriate. Deborah, can you give an update on the Cure Rare Disease ASO clinical trial? They are moving towards their first-in-human trials. They are not there yet, but we hope to see it soon. Karen is asking, does ataxia also have an effect on the nerves of the teeth? Because I have a lot of sensitivity in my teeth, but I can't figure out why. Oh, excellent question. The nerves that go to the teeth, they're part of the cranial nerves, are some of the shorter nerves. So if you have a disorder that is affecting nerve transmission, an example is Friedreich's ataxia. There's an associated neuropathy, which can affect nerve transmission, but the shorter nerves are usually protected until the very end. So, something that would impact the nerves, the shorter nerves that go to the teeth, a little unusual. However, any neuropathy, could affect any of the nerves, bigger nerves or smaller nerves. And if your dentist can't find a reason for teeth sensitivity, although teeth sensitivity, I think, is fairly common for people, based on, the health of the tooth and the structure of the tooth, definitely speak to your neurologist once you're cleared by your dentist about things that you can do that might reduce tooth sensitivity from the neurologic side, but the dentist might have recommendations just from the tooth side. Karen is asking, what would you recommend for severe neuropathy in hands and feet? Also curling of fingers, especially in the hands, suggesting that the nerves that supply the muscles are not strong enough to keep the muscles in the fingers on an even balance. So depending on how severe the neuropathy is, most people will start with a drug like gabapentin. If that doesn't seem to be strong enough or the higher doses are causing too much drowsiness or lethargy, then you can go on to Lyrica. And then beyond that, there are other medications that are used for neuropathy. There's a supplement, alpha lipoic acid, which is also recommended for use with neuropathy. And the curling of the fingers, best to work with a hand therapist to help control that, to keep the hands flexible, prevent them from getting stuck in one position. Natalie is asking, am I familiar with GAD65 cerebellar ataxia? I was told that only about 300 to 330 people in the United States have this. Now, the GAD antibodies are associated with another neurologic condition called stiff person syndrome. And this is where your body is making antibodies against the GAD65 protein, and they cross-react with the structures of the nerves or the cerebellum. So even though we think of GAD65 as being stiff person syndrome, it can cause an ataxia. And I have seen several people with this over the years. So treating the immune system can often relieve, partially reverse symptoms you might be experiencing. So have a discussion with your doctor about that. Now, Karen says, I've started dalfampridine 10 milligrams and have noticed a slight change in my dizziness. What is the minimum dose you prescribe for ataxia patients? If you work with a compounding pharmacist, they can make capsules with as little as 2 milligrams in them, giving you some flexibility in how much you're going to take at one time, how you're going to space out the doses. The typical 10 milligram available capsule is a time release, so that you can only take it twice a day. That's the maximum dose. But if you feel you want more immediate benefits over the shorter intervals, a compounding pharmacist can mix it up as little as 2 milligrams that you can begin working with. Sandy has a question. Should you do the Heimlich maneuver if a person is choking with food lodged farther down the esophagus? My brother coughs until the food comes up or goes down, SCA6. Okay, so the Heimlich maneuver is most useful when you have something that's blocking the upper airway. When food gets lodged further down the esophagus, it's not blocking the upper airway. So doing the Heimlich maneuver to try to dislodge something from the middle of the esophagus, it isn't going to have as dramatic effect as, dislodging it from the upper area where the esophagus and the windpipe share space. Now, coughing until the food comes up, it suggests that there could be some irritation in the higher area, not just further down the esophagus. The fact that cough does bring the food up is similar to what the Heimlich maneuver does. So, it looks like your brother has a good protective reflex that can prevent the food from getting stuck in an area where you don't want it. Now, Jenny has a question. What have we learned about links between SCA27B and dysautonomia? I have SCA27B and developed postural orthostatic tachycardia syndrome and gastroparesis after my first symptoms of ataxia. Certainly you would want to work up, other causes of your autonomic dysfunction, but I think we appreciate that most of the SCAs, with the exception of the pure cerebellar ones, could affect other nerve pathways, including autonomic nerve pathways. But because gastroparesis and POTS are common in the non-ataxic population, it's important to work those up first, make sure there's not some underlying cause that's confusing the picture. Is the CoQ10 that I have mentioned over the counter? Yes, it is. You can get it online. You can get it in vitamin stores. If you want to get a higher dose formulation as opposed to, a 100 milligram, if you decide that you want to take 400 milligrams per day, you can get that higher dose online from, various reliable suppliers. Then, looking further down the list, okay, so my husband was diagnosed with cerebellar ataxia in 2015. Since then, he can no longer walk unassisted. He uses a walker. Increased choking at the dinner table is occurring more and more often. So given the fact that your husband has had symptoms for 10 years now, or maybe a little longer, the odds are good it is not multiple system atrophy, which has a much shorter and more aggressive course. So it may be another ataxia, potentially a genetically mediated ataxia. So he's reached a point at the 10-year mark where he's using assistive devices, which is fairly common, but the increased choking at the dinner table is a concern. I would recommend getting a consultation with a speech and swallowing therapist and getting a swallowing test done to see if it's a problem with the type of food, the texture of food, or some other reflex that could be addressed with therapy. SCA2, question about stiffness, especially when first starting movement after sitting. Is that a sign of spasticity? It could be a sign of spasticity. It could be a sign of muscle deconditioning and muscles that you're not using and exercising. When you sit for a while, they will get stiff. And in SCA2, there's a stiffness that can be associated with the basal ganglia, which is the third motor system. We talked about the cerebellum, the spasticity systems, and then the basal ganglia system, which can cause movement to stiffen up. And often you then have to loosen up by getting moving again. So yes, it could be a sign of SCA2, and you may want to modify your exercise program and how long you spend sitting in a one posture to reduce it happening. So Paul has say, my questions have not been answered. Were they missed? Shall I submit them again? I see that Paul did resubmit. I see something down there at the bottom. So Angelina, who got in just before your second submission, has a question. Are there any contraindications in the physiotherapy program in Friedreich's ataxia that we aren't allowed to do in case we make the symptoms worse? For any ataxia, it's important to stay active. It's important to develop a physical therapy exercise program that's specific for you, including core strengthening, selective strengthening of legs, for instance, stretching, and rhythmic repetitive exercise or cardio. They all have a role in exercise programs for ataxia. The things that you want to avoid: do not exercise to the point of pain or fatigue that persists for hours. We often associate a good exercise program with feeling a little tired and a little good muscle soreness afterwards. But if it persists for more than a couple of hours, you've done too much. And that can get you into a roller coaster of, heavy exercise one day and then having to be in bed the next. There's nothing with exercise that's going to make the ataxia itself worse. Although if you overdo or are doing exercise in a way that is risky for falls, you could fall and injure yourself. So that's a good thing to be careful about. Now, Paul's questions. What genetic developments are there to detect ataxia genes so we can eventually slow the progression of ataxia? So there is, a long history going back to, the 1990s of slowly discovering new genes that are involved in genetic ataxias, both familial, dominantly inherited, as well as recessively inherited, or X-linked or mitochondrially inherited. So our technology is improving in our ability to test for repeat expansions in the common dominant ataxias, a test for point mutations or small deletions in some of the recessive ataxias or some of the dominant ataxias. So genetic testing is becoming more sensitive, and our knowledge of what changes in what genes may lead to ataxia is also improving. There is a national program, the Undiagnosed Disease Network program, which is looking for new ataxia genes. It was from that program that we were able to identify patients with some of the rarer ataxias. The SCAs now go up to SCA 50. Work with Canvas and with SCA27B has been enhanced by going over the undiagnosed DNA samples in that program and finding how frequent those things are. So definitely make sure that you're getting adequate genetic testing with available resources, and also enroll in the undiagnosed program. What developments are there for treating RSACs? We've already talked about that with another individual. What can we do to raise awareness of ataxia? So much research, but nobody seems to know about it. I agree, and the National Ataxia Foundation is working on better ways to raise awareness. I know Bill Nye, the science guy, is doing his part, not just for SCA27B, but for all the ataxias. So let's work together with NAF to do that. Are there any stem cell treatments that are being tried with ataxia? Yes. For non-genetic ataxia, the Mayo Clinic has been working with stem cells for multiple system atrophy, as well as a group in South Korea. And for the genetic ataxias, a group in Taiwan has been studying stem cells for ataxia type 2, 3, and 6. And they hope to come to the United States in the near future. Any difference with gabapentin versus pregabalin? Pregabalin, Lyrica, is a stronger drug with a similar mechanism of action, but the potential for more side effects. People who try gabapentin and fail it not because they're having drowsiness or lethargy, but because it's not working for them, may be advanced to pregabalin as a potential better agent in treating the symptoms of neuropathy. So, David, how effective is the new medication Skyclarys for Friedreich's ataxia? So what we learned from the MOXIe trial is that during the first year of use of Skyclarys, it could improve symptoms the amount that they would have worsened over a 2-year period. So I like to say it's kind of like turning the clock back 2 years for many patients, not for all, but for many. And then over the succeeding 2 or 3 or more years, it can slow progression so that even somebody who's in the middle or later stages of Friedreich's and starts Skyclarys, family members or therapists have commented speech is better, core control is better, arm coordination is better. So I think it's absolutely worth trying. The side effect profile is modest but manageable, and most of the side effects go away after the first month, most, but not all. Is omaveloxolone a pharmaceutical patent of Biogen only, or has it started to be produced in Europe also? Biogen is an international company. It is controlling the approval and release of Skyclarys or omaveloxolone in Europe and in other countries around the world. So we should stay in touch with their research and development group at getting the information out to things outside of North America. Does ataxia affect memory and brain intelligence sharpness? Yes. It can slow speed of memory and thinking. It doesn't get rid of memory, but it can slow it up. What would I recommend for that? Anything that we would do to make our own memory sharp. Stay mentally engaged, stay socially engaged, and keep your general health in good order. And I think we've reached the top of the hour.
Thanks so much for joining, everyone. Thank you, Dr. Perlman.